Okay, so it's my pleasure to be able to chair the final session of the day, and also provide you with a few thoughts. And really what we want to do with this final session, and then just so that we can finish at a reasonable hour, we'll have a panel discussion with all of the speakers tomorrow morning. But we've talked a lot about kind of the philosophy of the use of big data. And what we want to do with the rest of the afternoon is talk about data streams that are useful for environmental health decisions. And I think as a toxicologist, I think that I'm comfortable thinking about things in a toxicology and risk assessment context of the source to outcome paradigm. And I put this slide up to illustrate two things. One is, yes, in fact, all the children in Cincinnati do look like this. But thank you. But the second is that I just wanted to say, as a toxicologist, this is a really great time to be in the science. And the reason for that really is this accessibility of large data sets that have been generated by biotechnology that's only been available over the past 10 years or so, and the computational power that we have now to analyze these data. And the reason that I say that is that toxicology has been limited by the lack of data for a long time. So, and the way that I think about this is that, at least in an academic context, pharmacology is probably the thing that's most closely related to toxicology. And yet pharmacology lent itself very well to the reductionist approach that we were forced to take in pre-systems biology era, in that one was interested in a specific molecular target of a therapeutic agent. And one could, in a reductionist way, be very specific in investigating those things. And toxicology was the anti-pharmacology. It was the concern about all the other potential universe of targets that could be affected. And because we couldn't identify what all those might be and what the responses would be in any sort of a global sense, we were always, I think, criticized by using models that were insufficiently specific or looking under the lamppost. And all of that changed as we got tools that were able to globally evaluate a biological response, at least at a fundamental level of biological organization. The challenge for us now is to take advantage of that. And I think that one of the things that I really like about the way that toxicologists think is we've always been a synthetic science. And this is a synthesis problem. This is a synthesis across a variety of kinds of data streams to come up with a solution. So in that sense, it's really exciting. And the challenge is now just to do it and to bring along all of our friends with the different data streams, as we'll hear about today. So I just wanted to go through those three sources, biological response, outcome areas. And we'll have illustrations from each of these areas in the next 5 talks this afternoon. And what we've asked each of the presenters to do is kind of describe what these data streams are to some extent, and then talk about, to the extent that they can, how they've used these to address an interesting problem in public health or toxicology or risk assessment. But as we put this list of 5 together, which is still a large number, we realize that there are lots and lots of other data streams that we simply because of the matter of time, would not be able to represent. And I just wanted to, in some ways, just list some of these here. So in the source area, one can talk about anything from data like biomonitoring data that is at the interface between exposure and human biology, where there is a definite human component, to other things like toxic release inventory that's pure chemistry released from a specific site over a period of time. and perhaps can be integrated with exposure information using other data on demographics and geographical information system. I put in things like crime, and I just threw that in simply because we tend to leave out some of the really big public health drivers of our day, and crime can be a pretty significant one. Accidents can be, and all of those things that entail. So I just put these in because we have that kind of data down to the city block. I mean, it's really interesting. Until my knees gave out, I was a runner, and I knew where, within 100 feet, the areas that I shouldn't run by or, could go around the next block. But now these data are actually available in some sort of a codified form. And I understand that the police actually use these data now and put their enforcement. But these are data that also, in an integrated fashion, could help us understand, the relative contribution of social factors along with chemical factors and host factors. And just something just to pull out of the blue from that list that you're not going to hear about otherwise in the set of talks is geographical information system and water quality data and stream flow. I got this from a colleague of mine at P&G who does environmental work. And this is simply a way of using geographical information system data along with stream flow data at different times of the year to really make predictions and then go out. Those predictions can be tested in the field as to what concentration of chemicals from products that end up going down the drain, like laundry detergents, might be once they leave a wastewater treatment plant. And as people change their locations to perhaps more concentration in suburbs, one can adjust these models accordingly. And so, these can be tremendously valuable, and one can imagine how one could use this not just in an environmental toxicology context, but a human toxicology context. Biological response data, we've heard about a lot of things, and I'm not going to go through these to any extent. I wasn't sure where to put things like host factor data in, but again, we've got a tremendous amount of data coming up, not just on SNPs now, but on whole individual genomes, sequences, and that will be something that we can, again, integrate into our assessments. Just as an example of that, I put in something that I don't think we're going to hear about to any extent, and that's the tremendous amount of data that is logged into PubChem, where there are literally millions of entries on a variety of markers. And my sense is that one can start to integrate these data using both chemical structure and biological response at the cellular or molecular level to try and augment some of the things that are being done in ToxCast and Tox21 so that we can really get a fairly significant picture of how specific chemical features contribute to biological responses at a molecular level. And I think that this will pretty quickly accelerate our understanding of how molecules interact, again, in a global sense at a molecular level. Outcomes, we have everything from animal toxicology data and the ToxRefDB work that's been talked about by Matt earlier this morning to health data and disease registries that will be talked about later on today. And finally, I just want to leave you with some things to consider because this seems to be a very thoughtful and philosophical group. And as you hear these 5 really great talks this afternoon, just things to consider in terms of how to deal with large data streams. And the one, we kind of had it as our working title for the session is big data. So magnitude, of course, is an obvious one. But I tend to think about magnitude, I started getting into the big data area in the gene expression toxicogenomics area. And the first experiment I did, I kind of weighed as being kind of the equivalent of maybe 10,000 PhD dissertations from 1990. It was that level of value. So it wasn't so good if you'd done your PhD in 1999, and in 2001, one could do 10,000 times your work over 3 or 4 years. But that's the kind of magnitude that I'd like you to think about as in all of these talks, because that's the level of data that's being presented and allows us to address questions that 10 years ago were simply inaddressable with the flow that was limited at the time. Second thing is focal point. Which data set is the anchor? And this is akin to the cartoon of the New Yorker's view of the world. You know, we're all going to have different views and biases as to, you know, what all the rest of the data that we want to integrate revolves around. And I don't think that there's a right answer to that. Maybe there is. But in many cases, it's going to be dependent on the question that one wants to ask. And so I think, though, that it requires a lot of thought and attention as we start talking about how to normalize data as to what the focal point ought to be. And I think that there will be some focal points that are more equal than others. Integration across data sets, I don't want to say any more about that. A lot has been said about data management and data manageability and data sharing. And I don't want to say anything more about that other than one thing around sharing, which is, you know, some people are really good at sharing, and like kindergarten, others really are not. And I think that we have to devise ways to get around that. And, you know, clearly Dr. Farber in his examples gave us some examples how the might of a large institution like the federal government can work for you. I'm dealing with some frustrating examples of how the might of a government can work against you, which is, you know, I think one of the things that we were all really excited about with REACH, which is the European chemical legislation, was the idea that all of these data would be coming in from the chemical companies and we could use these. And then somehow something got slipped in where chemical companies can sell these data. So all of a sudden, getting those data in a shared fashion has a huge hurdle to overcome. And then finally, we've really gone around this question of should these big data and integrations be a matter of hypothesis generating exercises that are relatively unstructured, or should they be hypothesis testing exercises? And of course, the answer is both are valuable. And I think what we'll find is that as time goes on, we want these to be iterative. You know, we want to be in a position where we aren't biased by our previous information, but then there will be instances where that will lead us to a model with hypotheses that can be stated and tested using the data. So, you know, I think that that's a false argument, but in each of the data streams that we're about to hear about, you know, I think that they're at different levels. And so whether one wants them to be primarily hypothesis generating or hypothesis testing will again be dependent on the data that are being analyzed. So that's pretty much what I wanted to say in introduction. So let me just get to the first talk, and that is Francesca Dominici from Harvard on air pollution data.